Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, man, we're really excited to have you here. We're excited because we're having really interesting, exciting conversations with leaders that are painstakingly changing the future of healthcare. And we're just really passionate around a few key areas, leadership being one of them, innovation another, access, and then also adapting what's being done within our space. And we're focusing on bringing real stories of people that are actually doing stuff and making it happen. So that's what we do. We use our platform to share those stories with the world. And we've just got an amazing action-packed year with just some incredible leaders that are coming on, sharing great stories. If you haven't had an opportunity to check out any of our historical interviews, make sure you smash the subscribe button wherever you're at, just so that you get any of the new interviews coming right into your inbox. And our field, it's always evolving. It's fast evolving, and it's crucial to have leaders that envision the future and are eagerly embracing innovation to address a lot of these pressing challenges that we have going on. And our next guest is one of these leaders. I'm thrilled to bring on a visionary leader within our industry, Seth Ciabotti, but I call him Ciabotti because that's how you say it, true Italian. He's the Chief Executive Officer at MSU Healthcare. Seth's been a guiding force within healthcare. He's working tirelessly to make sure patients receive top-notch care no matter where they are. And his career has really been marked by roles that have continuously pushed the envelope in improving patient care, operational efficiency, and healthcare accessibility. And at MSU Healthcare, he gets to lead a new kind of health system where care is proactive, not just reactive. And under his leadership, they've initiated groundbreaking collaborations, expansions, reinforcing the organization's mission to enhance healthcare delivery. And this ambition and growth, really, it's about making healthcare more accessible, less expensive, while also improving the overall health of people in Michigan. And we get to discuss ongoing projects, innovative strategy that MSU Healthcare has been deploying, and just the overall vision of a healthier future. So, Seth, welcome to the show. It's great to see you. How are you?
Yeah, you too. Thanks, Michael, for having me. And yeah, I've been smashing that subscriber button and telling everybody to smash that. So we're going to get that subscription up, which it
Let's
already
roll.
is high, man, because
Let's go.
you're out there doing awesome stuff too.
So, can you share, Seth, just a little bit about your journey into healthcare leadership and what drives you every day?
Yeah, so it was probably just my parents pushing me to be get a job in healthcare. My sister is in healthcare too. She's an occupational therapist. I started off as a physical therapist. I'm actually never really used the degree, and then just um, after college, I just kind of started working for some insurance companies, and then getting into health systems and the real nuts and bolts of and hospitals and the nuts and bolts of healthcare. And just kind of just kept going along and working my way up the corporate ladder and end up here at an MSU in Michigan. So I've been here in the role about 5 years, and it's one of those things where there's the jobs where it's like people, they find something and they love it. I do. I love it. I don't see myself doing anything else. It's the perfect bridge between where obviously I'm an administrator, so I'm not a physician by trade. So the bridging the business side and the clinical side, it's really that's what I like the most about my leadership roles in healthcare.
So you're at that nexus, and I'm curious, sort of when you started, what was uh, what was your definition of innovation, and has your perspective changed since you started?
Yeah, so let's see. So my time at where I learned a lot about healthcare is my time at Mount Sinai Health System. I was there 14 years. So of course, that this I'll offend people, but I do think healthcare starts on the coast. The innovation of the hardcore parts of healthcare starts on the coast and comes in, right? So in New York, you've got, how many of the best health systems on the planet, and if you can walk to all of them in one day. And so
Yeah.
that's extreme competition, and it results in extreme innovation of constantly trying to get better. And so that was one really where I kind of had my thrown to the fire as far as learning healthcare and what it
Mm.
means and the innovation around it. But I just say the where the innovation part comes is one, um, just the idea of uh, just the competition part of having to having to just offer the patient experience has to be better than your competitor, but also you have to have some of the best doctors, you have to best some of the best research, you have to have all that kind of rat race is it's very different than anywhere else I've come across in the country. But I just say, on the innovation side, so we'll stick with that, except that might not have been fully innovation. That's more blocking and tackling, I'd say. But innovation side, at Tyne, I know the tagline was, if our beds are filled, it actually, we haven't done our job, right? That was one of the early times. So, that type of mindset of
Mm,
the all of healthcare happens, it's starting to happen, outside of the hospital now, right? And that's where everything is being pushed. And that model is perfect for the role that I took here. So again, 5 years at MSU, we are the modern day academic medical center, the modern day health system, right? So we
mhm,
have everything except a hospital. We're the typical, we'll say, little mini academic medical center. We have the physician practices. We have the academic side. We have all the ancillary, but again, not a full hospital on our books. And so what I say is we own pieces of hospitals because we're able to go out and do partnerships, bottom line splits with hospitals. And so you can think about that, right? Because over the next 20 years, you don't necessarily want to own a hospital, right? It's going to become a cost center. It's where you're pulling everything out of it. It's the high cost of care. It's kind of the opposite of where
right.
everything is going from government to the insurers, down the line. And so that this job, it's in its, kind of just the simple elevator speech is innovation.
It
It
is.
is the future of it's again everything except the hospital, or pieces of the hospital. That's it. I mean, that's what really kind of pulled me to the role.
You know what's interesting, as you mentioned around innovation, and then you also talked about competition and how that competition, that driving force to make you get better, just knowing that, hey, is someone going to beat us to this? And that's what actually moves you ahead. How do you foster if you're not in one of the coasts? How do you foster a culture of innovation within your team? And especially in an industry where we know healthcare is very traditional, there's some rigidity to it. How do you foster that culture of innovation?
Yeah, so it's a good question. So some of it I might not. I don't know.
You don't need to have all the answers, by the way. That's not, I mean, we sometimes we have
Yeah,
better questions
because
than answers.
I've started with there was a team that was, I inherited a team, and we've had retirements and changes, and so then I try to pull a new team in from really I've pulled the team in from, yeah, both clinical, meaning providers and non-providers, from the other health systems within the state. The reality is that some of them are a little bit traditional themselves, and so we've been able to pull it together. But it's really just looking outside of us, meaning as an entity, as a state, seeing what's out there. You can really find a lot out when you talk to people across the country. When you get in the conferences, you can find out what's out there. And so I've actually taken my team. Again, this is a small piece of how we change the culture, but I find really cool conferences and cool people to meet with, innovative people, whether it's, wherever they are in the country. They don't have to be on the coast, but I've set them all up so that way it's not I'm the only voice. Because who the heck wants to hear from me every day, just telling the staff all kind of ideas to do. And again, then the staff themselves have a lot of cool ideas, but I want to get them out there to meet all the really smart people out there in the world, and then come back with their own conclusions and ideas. And again, that's a sliver of how we've changed things here, but yeah, that's what I would offer as a part of transformation.
I'm curious because you mentioned something that just triggered a thought for me. You mentioned about sending folks to other areas of the country, and oftentimes there are breakthroughs can come in one field and can inform another. Is there an industry or a field that's unrelated to healthcare, which you or your team draws inspiration from, for innovation? If so, what is that?
Yeah. And so I think it's really the digital health side is where we've made the most push. And there's a line that I always use. And this is more, patient based. It's not so much it's not a really kind of a really sexy type of a topic. But I always say, uh, as far as how patients interact with us, whether it's over the phone or email or the digital communication, I say, does anybody know the number to call Amazon? Right? Because you can't call Amazon, right? And so what I say is most of what patients are interacting with us, whether it's a pay their bill, their appointment, you can go down the line, talk to their provider. That is all can be handled or it can be handled, for the most part digitally. And I was like, that's the model that we want to get to. And you'd be surprised, of all the places I've worked and other places that we talked to, no, not anybody's really solved it yet. And by the way, there's not one, IT, partner or vendor, however you want to say it, that actually offers all that. At least I don't think there is. And so, but we're small and nimble enough to be able to try to get there where we can offer a patient experience that, again, it's automated. Self-automated is where
Hmm.
is the term that we use that where we want to go.
Interesting how you bring that up, Ken. Does anyone know the 800 number for Amazon? That is a default mechanism, which is to pick up the phone and call.
Yeah.
Maybe I'm a little bit more old school, but how can you then, how do you then create an experience that's so seamless, it's so good, where it's like you don't necessarily, you can have a human in the loop, obviously as it escalates, but you know, maybe 80% of the time you don't necessarily need that. So how
No.
do you
No, I
talk
mean you
about
solve
the
everything, right? You can do returns on your right. You do we get those are all it's all transactions. Like we should be able to solve this. I mean, granted, we have like, I don't know, half dozen different tools, maybe a little bit less than that, but all these tools to be able to solve all those in those transactions that, was maybe a phone call and we're trying to, eliminate it. You'd be surprised how difficult it is to actually do it.
Yeah. Yeah. I mean, talk about the scale of MSU, clinical sites. You mentioned you guys don't own hospitals, but maybe talk about like
Yeah.
just, the team, how big it is and
Yeah.
et cetera, so people
So
can get an
we're
idea.
at 650 or so clinicians. We have one of the largest medical colleges in the U.S., and we have two. We have an MD college and a DO college. Um, there's about 300 or so of those physicians that rotate, or clinicians, I'm sorry, that rotate through our clinics. Our main market is in mid-Michigan. We spread out a little bit to the east and west. We are the largest multi-specialty and primary care practice from here to Grand Rapids to Detroit. And we do a lot of contract work where we're contracting with outside entities for services or we're contracting our providers. And when you take that into account, so we have 300 plus of those contracts. We actually operate in every county except six within the state. So we have a wide
Wow.
breadth of across the state. Again, from contract work though, you
That's
wouldn't always
contracting directly with the employers.
yeah, well, employers or we've got sending a provider to a nursing home or
Okay.
the medical director of a rehab center, things like that.
Okay.
And
Super
and
interesting.
employers too, which I want to talk about. There's some innovation there that we're
Well,
trying to do.
let's shift gears into that. Let's talk about your thinking about that and what sort of spurred that on and in that sort of that shift.
Yeah.
You mentioned about how innovation really in terms of what you're doing with MSU and the fact that like you don't own these assets, but you're shifting more towards the employer. Talk about the genesis of that and where you see it going and how you're
Yeah.
executing today.
So especially in the state of Michigan, right? So a lot of large self-funded employers, so they're covering their own health insurance cost, right? So
Yeah.
there's a whole lot of manufacturing, there's healthcare in the state, there's the auto industry, there's unions. These are all again, healthcare costs are the dime of them is being covered underneath the organization or the company or the entity. So,
Yeah.
as their costs are going up, then you look at the hospital across the street. Well, they're getting bigger, right? And it's because it's on the dime of these large self-insured companies. And so and again, this goes beyond Michigan. This goes across the whole country, but there's a little, there's a lot happening within Michigan since it's a state you can drive in a
Yes.
day. Um, they're all looking at their costs saying, well, geez, I got to figure out how to take care of this. It's direct to employer type strategies, putting a primary care, a wellness clinic on your company's campus and have the employees go there and help control some costs, control your medication costs, offering behavioral health, those type of services, which will helps then reduce the downstream, to the ED, to the urgent care, to the hospital. So that type of strategy is what we're really trying to tap into. So we've had a few different of those services created. Some of them didn't work, and we're still heavily, our strategy is in that field. But we've launched our own Medicare Advantage product, and we like to take that product and then eventually have that be part of the MSU Healthcare insurance product for the employees. And then we would like to do is then take it and then offer that to other self-insured entities or companies within the state and say, hey, we've taken care of our own and control our own healthcare costs. We can then take that to you and help control some of your healthcare costs. Again, this
Hmm.
is years and years down the road,
Right.
but I think Michigan is a great microcosm where you can do some of this, in a pretty good fashion.
With that expansion, into you mentioned these sort of employer-based clinics. What are the biggest obstacles and the biggest risks that you kind of foresee, and how are you planning to kind of overcome those?
Yeah. So many of these contracts, many of the employees' costs are still sitting within HR or benefits office, right?
Mm,
Maybe not the full knowledge of, and of the kind of what's going beyond, healthcare, where by the way, high quality and high cost aren't always the same. You can get high quality care with at a lower cost, and you just have to be able to go out and find it. So that type of thinking, I don't know that is fully out there within all the benefits, the HR benefits offices of large employers. They're starting to get it. There's a lot of work. I think Mark Cuban has done a lot with his prescription and his pharmacy companies with breaking into the benefits offices of large companies, and so that's the biggest barrier. It's the changing what's been in place for decades. And again, I'm talking this is across the country. You can see this challenge.
hmm. You mentioned around some of the digital health innovations that MSU has really been pursuing. How do you how do you and the team assess which technological innovations, or maybe might be service-oriented innovations, are worth pursuing?
Yeah. So some of it's just based on a market share that we're trying to capture. And I would say that's probably, some of the examples that I'll give. Yeah, it was just there was an opportunity within the market. So we'll do one. It didn't work. It was a failed initiative, but we were going to do a virtual physical therapy, right? So we have a PT OT practice, a rehab practice, which
Yeah.
actually has thousands of referrals go to. It's one of the premier ones within the region. But there's also thousands of referrals that are going out the door that are maybe going 30 or 40 minutes away. And that makes sense, right? Because physical therapy is local. You're not going to travel 3 times a week and go 40 minutes each time to go to your therapist. And so we had said, well, we got a great brand. We have great physical therapists. We have great PM&R doctors, so rehab doctors. And
Hmm.
so let's offer this virtual physical therapy option. It didn't work for various reasons from the IT side. We couldn't get it up and running, but we are offering that because there was an opportunity within the market.
Yeah. Well, how did the
The
market respond initially? Did the consumers, did they take, when I think about physical therapy, and I have a number of family members that are
Yeah.
physical therapists, I think about the human touch, the component of sharing. I'm just wondering if, what some of those barriers were that you guys
Yeah.
came
And
to
so
make.
we actually we didn't get to the point where we were launching it. You'd be surprised. So there was a lot of kind of IT type components that really
Of course.
failed us from launching. But that was one of the things that's, obviously virtual IT, there's a lot of it's a platform to work off of. And so against both, internal and external forces didn't to allow us to actually launch it. But I would say that when we went through, so we vigorously ran the platform through our own clinicians, and our rehab doctors were like, "This is amazing." They tested out the platform, and by the way, there's probably a half dozen or so out there. I won't name
Yeah.
names of the company and
Hmm.
everything, but there are a bunch out there. And so they were like, "This works." We just couldn't get it was like failure to launch. We couldn't get the logistics out there to set it up. But yeah, I mean, again, so it was looking at where we could capture the market, determined where we were doing where we wanted to go with IT or innovation, right, or digital health. And so another example was this is sleep studies, and we were doing sleep studies
Hmm.
for it was at-home sleep studies, which there's sensors now. There's a bunch of companies
Yeah.
out there that can do this. That one was the same. We had the market. We don't have a sleep center, and so we had said, well, maybe we don't need one. Maybe we can send it out and have it done at home. And so that was, again, we were trying to capture the markets. And again, another failure to launch, and maybe some of the companies that we chose weren't the best ones. But yeah, I mean, that's how we've been choosing to go about digital health. It's gaps in the market.
You know what's great to hear? And, people will love to talk about innovation and the glamour of it and the sexiness of it. You don't necessarily talk about how difficult it is to
Yeah.
do something at scale, even to start something off and to get it through the IT process. So just the fact that you've been able to illustrate that, hey, like these didn't work out. And, we're not going to dwell on it. We're going to figure out what happened and we're going to use it and use it in a constructive way. Has has that type of philosophy always been in place at MSU, or is that something that has come from sort of top down to say, hey guys, failures will happen, and how do we sort of put them in a way that makes it more constructive as opposed to shaming and things of that nature? How do you make it so that it's good in the long run for the organization?
Yeah, so it's a great question and point. So yeah, so what I do say, probably for every 10 ideas that we have that we do, probably only one or two is going to stick. Like they doesn't always, not everything that you do is going to work. So I mentioned the two that didn't work, and then on the other side of this, we have two that are launching. We're using AI for coding the charts. We're also using AI for transcription. And so it listens to the visit, what's happening in the exam room, and then dictates a note. So those two are launching, and those will, as of this point, they're going to work quite well. There's not going to be any failure to launch there. And so yeah, we got to keep trying. I've also said, just from a business, a dealing perspective, I was like, we have to make deals. And so your initial deals may not be the deals that really lead you to something great. It's usually the second and third layer. So you can't be afraid of getting those first initial deals down, those relationships. Because again, we're a little bit of Switzerland. So we partner with everybody in the state. So we actually have a bottom line split with every health system in the state, almost every health system in the state at this point. But we didn't get there by doing it all at once. We actually did a little deal, a little baby deal. We
Yeah.
did, and then you got to build upon it. And some of those other deals, they don't even work anymore. Some of those early business goes, those early relationships, we're ending them. And so you gotta be able to keep going, pick yourself up, the resilience that a lot of healthcare spends time studying resilience. Well, we're living it each day.
You're living it. And do you feel like much of that, having been in let's just call it, in a really competitive environment in New York, did that really build you for this, knowing that, hey, we're going to get some setbacks, we're going to keep moving forward because you were in the cooker for 14 years. It's like
Yep.
that galvanizes you. So just wondering how much of that credit goes to the 14-year quote unquote, tour of duty that you had at Sinai.
Oh, it absolutely does. It is the cooker is a great analogy. And that's it. That's where it just you have to just keep going, pick yourself up. Because I'd even go back to the kind of the entrepreneur side. When I was before I was down in New York City, I was in a private practice that we took a neurosurgery private practice that uh, I remember we went out and went to Target and we're getting exam room tables. We fit up a whole practice. We were getting lamps. We started with
Yeah.
nothing, right? And then in one calendar year, from one neurosurgeon and a few administrators, a few in a PA, we went to like a 10,000 square foot space. I think it was more than 10,000 square foot, having imaging, having more neurosurgeons, having pain management,
In
having
1 year.
PT in 1 year. We did that, and I was part of that. Was myself, another administrator of mine, and then a neurosurgeon, and the three of us were able to take that in one calendar year. And so that type of thinking of how you can do anything, like we were
Yeah.
buying things on Amazon. We were buying things and equipment and wherever you could, get all of the, things that you need to fit up an office and run it, and and doing the billing, and it was just all that type of mindset, the entrepreneurship. That also, I think that that led me and helped me down in New York City, and then that was in the cooker. And so here I am with that kind of mindset of
You
the
know,
scrappy type of mindset.
listen, I love this. This is my personally, this is my mentality, being an underdog. And I tell people that I talk to a lot of different emerging companies, and the best attribute that you can have is early on is to be a Swiss Army knife. When you have team members that are Swiss Army knives, the best tool that someone can have when they're out in the wilderness, and especially when there's a lot of uncertainty, it doesn't it doesn't come in more in handy than that time. I want to switch gears for a moment. Where do you see, I mean, you see a lot of stuff, but where do you see the biggest gaps in healthcare that still need innovative solutions?
Yeah. Um, I'm gonna stick, and I say this, all the time, stick with the direct to employer piece, the innovation of getting that direct to employer care, whether it's, I said, the wellness center, whether it's your behavioral health services, your prescription, your meds, your prescription, your pharmacy services. That is where I think the biggest innovation is going to, because again, these large employers are starting to realize that, when they look at their bottom line each year, healthcare are the biggest expenditure, and they're like, I don't have a whole lot of control over that, or how do I get control over that? And so I think that's where it's the biggest innovation in healthcare, and it's happening. When you go in certain spaces, some of the spaces that we've been in those worlds, you
Yeah.
see it happening, and then of course you get on the other side where you go to a conference with all the top health systems in the country, and it's a totally different vibe. They're almost working against each other, is
Mm.
what I've seen. But I think that's where it is, because we have to figure out something. We have to figure out how to control the cost of healthcare, and it starts with the large employers and small employers, self-funded, I would say.
You know that you're talking about something, and maybe I just want to bring it out just to name it to tame it. It's when fundamentally something has been working well for years on end. What someone would have to do to innovate fundamentally, that means that they might have to completely take their initial way of doing things and, you know, basically toss it out. And that can be really, really frightening to a senior leader that's
Yeah.
sitting in a seat that has a board to report to, that has, if they're publicly traded, that, you need to report to the street. I'm curious, what is something that you fundamentally believe about healthcare that most people in the industry disagree with?
Yeah. Well, so what I just said about the direct to the
Yeah.
employer, right? I can only say that with the entity that I'm the CEO in, because we're an entity
Yeah.
that, we're not beholden to feeding that large hospital per se. Now we have it in some relationships and in certain services, but if I was the CEO of a large traditional health system, I don't know that I'd be saying that, right? Because again, like I said before, they're working against each other, really.
Yeah.
And so that would be the difference. Although I don't know that the the CEOs of the traditional health systems, I think they know that, but at the same time, in some instances they don't, if the large employers in their state or the ones that are across the street, if they're not going to think about that innovation on their side, then you don't have to make the changes, right? It's really when those large or even small self-funded employers start realizing where their dollars and their spend is going, and they start coming together. That's where you're gonna have to start making change if you're a traditional health system.
It sounds like, you enjoy change. And
Yeah.
not many do. And has there, maybe to the degree that you can discuss this, has there been a particularly, because you have to make a lot of decisions. Has there been a particularly tough, leadership decision that you've had to make in your career? And then how did you approach it? And what was that outcome?
Yeah, so I think it's here transforming what this role. So we used to actually be called, we were a totally different entity. We were called the MSU Health Team. It was an organization that was kind of wrapped up within the university, and so the university some 6 years ago made a decision to break out their clinical enterprise, saying that since we're a state institution, we couldn't do relationships with outside entities, whether they're private or public. And so they needed to break it out, put it into a separate company, rename it MSU Healthcare, and then name the first CEO, and that was me. And so just the job itself is the blueprint to is to the innovation, to the tough leadership changes, or the tough leadership decisions to make this a go, because we're still here. It's 5 years in and we're here. I mean, this might not have worked, right? After a couple of years, I mean, by the way, when we started this, COVID hit a year
I,
later,
I
which
was
didn't
gonna say
really
you.
help us. Yeah. So, we went live during COVID with a new healthcare entity. We were basically, and we had to rebrand ourselves, but you wouldn't rebrand yourself during COVID. And so that's it. I mean, the blueprint that we've done here, is the answer for you as far as tough leadership decisions.
And you mentioned the COVID and stuff. You've obviously had to lead through a lot of uncertainty. What qualities do you think are essential in those types of times? I mean, it seems as though that we are in some interesting times, so especially with a lot of uncertainty that's at stake here. What do you think is essential in terms of your leadership capacity and things that you look at?
Yeah, so I go back to the resilience, the okay to fail, whether it's me or whether it's my team, or even folks beyond my team. The ability to debate about an idea, because if somebody just listens to my idea, or the other, we listen to this, we take someone else's idea for it. There's a debate. And so if some of my team meetings, we've got a lot of like debate, and we come to a solution though at the end. I
Yeah,
mean, and sometimes it's not like super fun, but like we're coming to get ideas. It's the cooker mentality of let's come out of this Zoom meeting or in-person meeting with an idea.
absolutely. And so just as sort of a fun fact question, just, outside of your professional skills, clearly you have many. Do you have any hidden talents, hobbies that indirectly sort of contributed to your success?
Yeah, so I think the really into my own wellness, right? My own wellness, looking at just using the supplements and the fitness and the really into like the biohacking. So that type of mentality,
Okay.
that wellness, I've is really, I think it's something that you can translate to the medical side, to the
Yeah.
traditional medical side. And so I think that's what I do. That's the hobby
What's
that I
a
think connects.
what is one biohack? One biohack that you're willing to share with us?
I'm still trying to figure out which biohack I want to
My wife is super into biohacking, and she's like
Yeah.
constantly coming up with things. She's like, "Hey, you need to do this," and I'm like a guinea pig. It feels like I'm a guinea pig. But I'm still
Well,
here.
there's the
I feel
the big
good, so
one.
it's a good thing.
I mean, there's the yeah. I mean, there's a few. I mean, there's a few like the nutritional ones with the the whole seed oils and what. Not necessarily a biohacking, but I do want to take the methylation test, right? Um, I want to take that, which I think should then
Is that the
really
MPHR one? It's like if you're MPHR, I think maybe I'm thinking of something different, but
it no, there's a few different versions out there. That sounds like the right term, but yeah, I want to do the methylation that's like a DNA methylation test. I think I'm probably screwing that up, but yeah, that's what I think is the next step for me.
so you know what it is? It just sounds like you like to tinker. You
Yeah,
like to tinker, you like to test, you like to experiment, and that's how you innovate. You can't innovate without doing lots and lots and lots of experiments. It's just not possible. And your lab is MSU Healthcare, and you get to do it in that lab. And you do it in a way where you feel like you're being responsible, for patients and making sure you deliver great care and deliver to them on time and, at a great experience. And that's something you're not willing to compromise. What is just sort of as we wrap up here, and we're all about taking action. So if there is one golden nugget, one action that person's listening to this, what is that one thing that you would tell them, hey, do this.
yeah.
This is take action on.
Yeah, it would be a statement, advice, however you want to say it. So to your point, success it's not necessarily linear. You can go up and down and still end up with the same, result at the end of the day, or whether it's a month or a year. It's okay to be up and down. I think in today's world where it's a different environment than it is, business operates differently than 20 years ago. I think it's okay to be, up and down as long as your strategy and your end goal is to where you want to go. You can't be afraid of the ups and downs. And so that's where I'm in a comfortable space there.
Tremendous, man. Seth, this has been awesome. I appreciate you being fully honest, very transparent. It's a breath of fresh air. You don't always get that, so it's nice when you do get it. It's great. And for those, if you've tuned in and you found this content and this conversation particularly helpful for you, my ask is, would you mind sharing this on social, liking it, commenting on it, with your network? It makes a difference when we can advance healthcare forward, and that comes through connectivity and community. And we're grateful for having an awesome community. So, Seth, you're always welcome to come back on. We always have this open door policy as you start to experiment and do more things, the learnings, you're welcome to come back on. So thank you for coming on, and I look forward to our next conversation.
Thanks for having me.